Hi there. In case we haven't met, my name's Chet Kuhn with Medicare Hero, and today I'm going to be showing you how to easily shop and compare prescription drug plans online with our new prescription drug plan finder tool. This is one of the easiest way to shop and compare prescription drug plans online, view your specific medication costs, and to find the right plan for you. So follow along as I walk you through step by step, and I'll show you how to shop prescription drug plans online.
All right, so you can access our new prescription drug plan finder tool by going to the URL address shop.medicarehero.com, and it will take you to this landing page right here. Now, there's two different ways you can get started. You can either go directly and view plans that are not personalized for you, or you can do what I recommend and click on the Help Me Choose button. We'll just walk you through and help you customize your results so that you're actually looking at the prescription drug plans available based on your medications that you currently take. So I'm going to start by clicking on Help Me Choose. Next, we're going to enter our zip code. Now, if your zip code overlies multiple counties, it'll just ask you to select which county you're in, and then click Next. And then it'll allow us to enter our prescription drug list. So what you can do is just start by entering the first three letters of each of your medications, and it'll pull up a list of medications that you can choose from. So in this case, I'm going to type in LIS, and our medication that we're looking for is lisinopril. Next, it's going to ask you for the dosage that you take, or how many milligrams. I'll select 10 milligrams. And then it'll ask, how often do you refill this medication? Do you refill it every month? Do you get it every 3 months? And so forth. We'll say we get it every month. And then the final thing it'll ask is, how many do you get per refill? In this case, we'll say we take lisinopril once a day, so we get a quantity of 30 tablets each month. So we'll just leave that at 30, and we'll say Add Drug. Now, as you add medications, you'll see your medication list down here will grow. So if you ever need to remove a medication and alter it, you can do that right here by clicking the X. But we'll go ahead and add a second medication. I'm going to type in Atorvastatin, ATO for Atorvastatin, which is a high blood pressure medication, excuse me. If you ever see a medication highlighted in yellow, that's just telling you the most common dosage. So if you don't know what your current dosage is, you want to go with the one highlighted in yellow because that's most common. Again, it's going to ask you how often you refill this medication and the quantity per refill. We'll say Add Medication. And you can continue doing this until your medication list is full. For the sake of this example, I'm going to scroll up and add one more medication called Eliquis. Let's see here, E-L-I, and you'll scroll down and see Eliquis right here. I'm going to select 5 milligrams, which is the most common dosage. We're going to say we get this refilled each month, and when we get it refilled, we get 30 tablets at a time. So we'll say Add Medication. So now we can scroll down and see our completed medication list at the bottom. If everything looks good, we can come over here to the right and just click Next to continue on with the quote. Now, when you get to this health page where it asks how often do you see a doctor or do you receive medical care, you can just completely skip this page. This has nothing to do with standalone prescription drug plans. It won't affect your quote at all, but I just recommend leaving it blank, going down to the bottom and clicking Next. Now this will take you to a page that will ask you to select your preferred pharmacy. Your pharmacy will default to the nearest major preferred pharmacy, but you can change that preferred pharmacy. You can select a local pharmacy if it's not a major chain that you use, or you can select that you use mail order if you typically get your prescriptions mailed. So whichever you prefer is the one you can select. I'm just going to select CVS Pharmacy for this example, and we'll click Next to continue on. Now, on this final page, it's going to ask you for your current Medicare plan. If you are currently enrolled in a prescription drug plan, then this is where you'll want to enter that prescription drug plan so that you can compare your current plan to your other options available. So for this example, I'm going to say that we currently have a Humana Basic prescription drug plan. Okay, so once I find the name of the plan, I'll enter that in here and then click Next. If you don't know the name of your current prescription drug plan, or if you don't currently have a prescription drug plan, if you're new to Medicare, then you can just leave this blank and continue on. So now that we've entered all of our personal information, it takes us to the results page where we can review our results and the different plans available. Now, once you get to this results page, the first thing that you want to do that I highly recommend is come up here to the top and click on the Save Progress button. That way we can re-access this personal information again in the future, and we won't have to re-enter our information to look at these quotes again. So click on the Save Progress button, and then you'll want to first write down your personal code. This is an 8-digit personal code that you can later enter to view your quotes, or if you need help from one of your agents, you can give us a call, and if you provide us with this personal code, we can pull up all of your quote information and walk right through your different quote options with you, hand in hand, and kind of explain any questions you might have and help you choose the right plan for you. We can even assist you with all of your enrollment paperwork. So make sure and first write down this personal 8-digit code. Next, what you want to do is come down and you'll see this little link right here, and you want to click on that link. When you click on that, what you'll notice is it's just going to take you right back to the very same page that you're just on. But what it does is it actually inserts your personal code into the URL, which is saving your plan results. So now if you refresh your page, it won't lose any of your results. It'll still have all of your information saved. So once you click on that link, then what you can do is, if you want the easiest way to return to your quotes in the future, is just click on the little bookmark star at the top of your browser. Most different browsers like Chrome and Internet Explorer, Bing have a star at the top somewhere where if you click on it, you can save this link. So I'm just going to type in Chet's Drug Plan Quote. Now I'm going to save that, so if I ever need to come back, I'll have this link saved so I can do so. Okay, so now that we got our quote saved and we wrote down our personal code, let's review our plan options. Now, this quoting tool is used to quote both Medicare Advantage plans and prescription drug plans. So if you have a Medicare supplement plan and you're reviewing your prescription drug coverage, you'll want to make sure you're looking at the right type of plans. This tool typically defaults, you'll see there's 3 options here. It defaults to the one on the left, which is Medicare Advantage. The one in the center is also Medicare Advantage. So if you're looking for standalone prescription drug plans, make sure that the button on the right-hand side is the one that's highlighted. That's the one you want to be looking at. So Medicare Part D plans. Make sure and click on that. And now we can scroll down and see our plan results. Now, if in the previous step you entered your current prescription drug plan into the tool, then it's going to put it right here at the top. So earlier we indicated that we currently have the Humana Basic plan, and so it put it at the top with this blue border around it. That way we can compare our current plan to our other options. For each plan, it's going to give you some simple information. It's going to give you the name of the plan, the insurance company. It's going to tell you the monthly premium of the plan. If the plan has the deductible, which most do, it'll tell you what that deductible is. And then it's just going to give you a basic overview and tell you how many of your drugs are covered by this plan. So currently, 3 out of our 3 prescriptions that we entered are covered by the Humana plan. Now, the way that this prescription drug tool calculates these plans' cost, and the way that we highly recommend comparing plans and choosing the best plan for you, is based on your total out-of-pocket expenses for the year. So what this is going to do is this is going to add up all of your expected expenses for an entire 12 months into one number. That includes the monthly premiums all year long. If your plan has the deductible, it'll add that deductible in, as well as your copays that you'll pay when you pick up your prescriptions, again, for your medications all year long. It adds all those costs up into one number that's the total that they expect for you to pay for your prescriptions over the course for a year. So for example, for this Humana plan, they're estimating that I'm going to spend about $1,350 on my medications over the course of the next year. If we scroll down and we see the next plan, which it's ordering these plans from the least expensive for us down to the most expensive, so the option at the top is always the best one for us. It's recommending the Mutual of Omaha RX Value prescription drug plan as being the least expensive for us. And it's suggesting that over the course of the year, this plan would only cost us $993, which is a saving of almost $400 over the course of the year. So with Humana, it's about $1,350 over the next 12 months. Mutual of Omaha, it's about $990. So Mutual of Omaha looks like the better option. Now, if we continue to scroll down, you'll notice that these plans just get more and more expensive. That's because this tool is putting the least expensive plan for us right at the top underneath our current plan. So in this situation, it looks like it would be a better value for me next year to switch to this Mutual of Omaha value plan. Now, if you want to go into a little bit more detail and compare your copays and things like that, what you can do is you can click on this compare button under our current Humana plan, as well as the Mutual of Omaha plan that it's recommending as being best for us. If we then come down and click the compare plans button, it's going to put these two plans side by side. Now, it's going to default to the benefits details tab, which is just the generic details of the plan. It's not going to be very helpful because it's not personalized for you. It's just going to tell you the monthly premium, the deductible, and things like that. What I recommend if you want to compare plans is to click on the drug cost details. This is the plan, or this is the tab that's really going to help you compare your personalized medication costs. So here on the left, you can see we have the Humana Basic Value Plan. I'm sorry, the Humana Basic Plan. That is our current prescription drug plan. And then there is the Mutual of Omaha RX Value Plan that this tool is recommending as being the best option for us. So now if we scroll down, the first bit of information it's going to tell us is a little bit about each medication. Remember, we have our Humana plan on the left and Mutual of Omaha is on the right. So with Humana, our first medication, Adverstatin, it's telling us is on a tier 2 versus Humana has it on a tier 1. It tells us if there's any quantity limits for the medication. So in this example, we have a quantity limit of 30 tablets in 30 days for both plans, but that's our current dosage, so it doesn't affect us. Neither plan requires any authorization for this medication. There's no step therapy required, and this just tells you the retail price of the medication just for your reference. And it does that for each of these medications. If we continue scrolling down until we start seeing the months labeled over here, what this is going to do is tell us our projected prescription drug costs for each month of the year. If you're new to Medicare and if your coverage is not necessarily starting in January, if it's starting in March or April or June or whenever, it's still going to outlay these costs the same way. So just consider January to be maybe month number 1 that you have this coverage, and then month number 2 and 3 going on. So in January, here's what our expected costs are. It tells you the cost for each medication that particular month, and then it tells you the total for the month. So in copays, it expects us to pay about $260 with Humana and about $230 with Mutual of Omaha. If we continue to go down, it looks like in March, our costs go from, for Humana, they drop to $63 because we've met our deductible with both of these plans now. And so with Humana, we're going to pay about $63 a month for all of our medications. And for Mutual of Omaha, we're going to pay $26 for all of our medications, which is almost a $40 per month saving. We can go down and look at this for each month of the year. We can go all the way down to December. We can see all the way through December, it's going to be the same thing. $63 a month with Humana versus $26 with Mutual of Omaha. So this plan, this new Mutual of Omaha plan, clearly looks like the best option for us for next year. It's just that simple. If we scroll up to the top, if we want to go ahead and enroll in this Mutual of Omaha plan, all we have to do is click the green enroll button. It brings up a really simple, user-friendly application where you can type in your name, your Medicare number, and a few other details, and you can sign right up for this plan. Or you can come up here to the top, and you'll see our phone number is listed right here. And again, it will give you your personal code. So if you'll just give us a call and provide us with your personal code, we'll be able to pull these plans up, answer any questions that you have, and help you enroll and help you complete all the paperwork. If you choose to enroll yourself by clicking this green button, you're more than welcome to. Once you submit that application, it will notify us so that we can review the application, make sure everything looks in good order, and we can follow it all the way through the approval process to make sure everything goes smooth for you. So even if you apply here yourself, you still have access to us, our agents, and all of the services that we provide. It's It's just the simplest and easiest way to go, and we can still provide you with all of the support that you'll need. Now, one last real cool piece of information I like to tell everybody is a new benefit that we have this year is that we've partnered with the Feeding America program, and every application submitted through this enrollment tool, whether you sign up yourself online or whether you call us and we assist you with the enrollment, helps feed at least or helps to provide at least 10 meals to seniors, veterans, and children in need. It provides them with 10 hot meals for every enrollment through this platform. So thanks to the Feeding America program, and that's just one more benefit that we've included in here because we want to help give back to the community that we serve. So if you have any questions, feel free to reach out to us. Our phone number is right here at the top of the page, and let us know with any questions or comments. We're here to help. Thanks so much.